Now next topic is posterior hip dislocation. So what is posterior hip dislocation? This is acetabulum. This is acetabulum. This is femur bone. Okay. Now there is a difference between dislocation and fracture. So what is dislocation? So this is joint, this is hip joint. It is constituted by acetabulum and femur bone. And which part of femur bone? Femur head. So femur head and acetabulum is constituting the hip joint. Okay. So that's why we are walking, because femur bone, femur head is in acetabulum. Okay. We are using this arm, using this upper limb because humerus head in glenoid cavity of scapula. Okay. That's why we are using this upper limb. Now let's assume if that humerus head or that femur head goes out of the acetabulum, there is no any fracture. I'm not talking about any fracture. If that femur head goes out of the acetabulum, it could be anterior or it could be posterior. So most commonly, femur head goes in the posterior. That is known as posterior hip dislocation. Now you are sitting. This is car. Okay. This is front. This is back. This is driver seat. This is co-driver seat. Now you are sitting in co-driver seat. Okay. So if let's assume there is a jerk from the front, if there is a collision from the front, this bonnet will give you jerk at your both limbs. So if you give jerk at your both limbs, there is a chances that your femur head goes posterior because there is a jerk from anterior. Okay. So that's why dashboard injury is most common injury for posterior hip dislocation. Okay. Are you getting the point? This is femur head, this is acetabulum. If there is a jerk from anterior, then the femur head will go in posterior. That is known as posterior hip dislocation. And patient will present in FADIR. What is FADIR? Flexion, adduction, internal rotation. Okay. Okay. Now this head goes in posterior and the femur head blood supply is very precarious. Every fracture or dislocation not goes in AVN. Every fracture is not will go in AVN. There are some places like scaphoid, I have already explained to you. Femur head, they have precarious blood supply. So you have to be very careful if there is a fracture in scaphoid or there is a posterior hip dislocation. It goes in avascular necrosis. It goes in AVN. Okay. Now there are various hip reduction maneuver. That is BEAST, that is big loss maneuver, East Baltimore maneuver, Ellis maneuver, Stimson maneuver. Okay. I am not going in details of all these maneuver, just remember the name BEAST. Okay. Now this head is goes in posterior. So how will you manage this patient? So you have to reduce this femur head in acetabulum again. Okay. So you have to do, and it is very painful to reduce. So you have to give anesthesia, you have to give general anesthesia and reduce this dislocation. That is known as close reduction. You are not giving incision any, you are just pulling the leg. So that is known as close reduction under anesthesia. So this is the management. If you will not reduce this dislocation, that will go in avascular necrosis. Okay. So these are the notes from my rapid revision course of orthopedics. So these all lectures are available in my app, Dr. Priyesh Nayak App, which is available on Playstore or App Store. Okay. Thank you so much.